Welcome back, everyone. Thank you to Samaritan Counseling, Jamie, Tony, and Jane at Oshkosh West High School for allowing us to see how the connected communities work. Joining me now is Lynnsey Erickson and Debbie Peters. Lynnsey is an AmeriCorps volunteer with Rethink in the Winnebago County Health Department, and Debbie is director at Community for Hope here in Oshkosh. Thanks for joining me.
Thank you.
Before we switch gears to our mental health services in the community, we wanted to talk to Lynnsey just a little bit about your AmeriCorps service year, a little bit about your interests and why you chose to do a year of service.
Yeah, so I think, as I said in the field segment, I'm a recent grad of UW-Madison, go Badgers.
Yay.
And I graduated with a bachelor's degree in psychology and gender and women's studies. So my focus there was mainly on mental health and prejudice and stigma. So I chose to kind of go with an AmeriCorps position just for that hands-on public health experience and dealing with these issues that I really feel passionate about. So it's been a great experience so far and kind of getting to know Winnebago County and helping out with mental health issues here. So
Great. Well, we are really happy to have you, and we're so pleased that you're able to be part of our team.
Mm-hmm.
Would you like to tell us a little bit more about the 211 program?
Mm-hmm. Yep, so the 211 service is put on by the United Way, and it connects callers to a variety of resources. So someone can call if they're experiencing depression, bipolar disorder, anxiety, suicidal thoughts, any kind of issue like that. And it covers about 10 counties in northeast Wisconsin, which includes Calumet, Fond du Lac, Green Lake, Outagamie, Wapaka, Waushara, and Winnebago counties. And the service is free, confidential, and available 24/7. And I have a poster here. Mm-hmm. So we have these, we'll be hanging them up in local businesses so that people can tear off a little sticky here. Mm-hmm. And it has the information, if I can tear one off. So if someone needs help with any of those issues, or they have a bunch of other resources available, they can look for those posters and tear it off. And if any local businesses are looking to hang one of these posters up, that would be great. They can call the Winnebago County Health Department at 232-3000, and we can get one of those to them.
Right, and like Kristen said earlier, so even in bars and salons and all over in the community.
Yeah, anywhere where people might be needing help or something like that.
Great, great. And so you can call 211, easy to remember. There's web access.
Yep.
So that's...
it's www.211now.org.
Okay, great, great. Yeah, this is a really great resource for our community, and thanks to partnering with the United Way and helpful for resources, getting resources to the people that need them.
Yeah, yeah.
Great. What about within the health department? You've been working on some social media.
Yeah.
Can you tell us a little bit about how you've been able to combine some mental health concerns and social media?
Yeah. So for me, I've been working a lot with social media and get more out there with mental health and just trying to reduce the stigma about it so that people can kind of open up this conversation about mental health and talk about issues that everyone experiences. Everyone has mental health, and we can all talk about it. So I've been doing a lot with Facebook and Twitter, posting about different articles that I find, or there's different days that happen, like Mental Health Awareness Week, posting about that. And then also every Monday I've been trying to post a hashtag Mental Health Monday tip. So different tips on Facebook about how to improve your mental health, how to kind of keep track of your mental health and check in with yourself. So if anyone wants to see the posts that we're doing about mental health on Facebook, they can go to our website, www.rethinkwinnebago.org, and click on the little Facebook logo in the upper right-hand corner.
Great, thank you. Let's switch over to Debbie. Debbie, you are the director at Community for Hope.
Yes.
Can you tell us a little bit about Community for Hope?
Certainly. Community for Hope is a nonprofit organization that started in 2001 in a response to recent teen suicides. We grew from the aspect of just focusing on that age group to all age groups, that we see a large variety of those who are dying by suicide.
Okay.
We serve Winnebago County and are very proud to be helping in the community.
Right. is there a way that we can prevent suicide?
I believe that one of the best ways that we can prevent suicide is, first of all, talking about suicide and reduce that stigma that has been occurring, and really we need to overcome that. And one of the best ways that we believe to do that is with a program called QPR. It's an hour and 15-minute training session.
Okay.
We offer it for free. We train people very similar to CPR, but QPR is question, persuade, and refer.
Okay.
We teach people how to ask that important question, are you thinking of suicide? In a very effective manner.
Right, right. And how does Winnebago County compare to the state for suicide rates?
Unfortunately, Winnebago County has a higher suicide rate than the state of Wisconsin and also the national average. So we are working really hard to reduce that, and certainly mental health plays a huge role in those that are dying by suicide. 90% of all of those who die by suicide have a mental health illness.
So it is really important to be able to talk for loved ones, people close to somebody that may be struggling, to be able to have that dialogue.
Yes,
with
exactly. And QPR teaches everyone how to recognize the signs, which are very important. And again, with working with adolescents and teens, sometimes it's hard to determine what is normal and what is not, when we should be alarmed.
Right. And if you know of somebody in crisis, what can you do?
We like to recommend that they immediately see, if it's a dire need, certainly call 911 or go to the emergency room.
Okay.
That would be the first priority. If it's something that you feel would be appropriate to speak to your family physician, a school counselor, even at your employer's office, just tell somebody and ask for help. Asking for help is the first step.
Okay, and that's just a key point to try to, like Lynnsey said too, about trying to break the stigma of being able to talk about this.
Yes.
Yes. Well, thank you for explaining that and your organization. It's really important service to the community. So we are about out of time for today's show. I want to thank you both, Debbie Peters and Lynnsey Erickson, for coming and sharing resources from the community perspective, Community for Hope, and the 211 resources. Today we hope you enjoyed the show and you're inspired to embrace wellness and take time to focus on mental health, just like you pay attention to physical health. A nice way to remember this is that there's no health without mental health. Don't forget, you can always connect with Rethink on our Facebook page, www.facebook.com/Rethink Winnebago, on Twitter at Rethink Winnebag, and on our blog, the Rethink Winnebago blogspot.com. And our website, of course, is www.rethinkwinnebago.org. Until next time, let's keep creating a community that makes the healthy choice the easy choice.